If you've ever left a doctor's appointment thinking, I didn't explain that properly, this video is for you. Because so many women go into appointments with symptoms that are real, disruptive, and often quite complex. And then you get 10 minutes. 10 minutes to explain months, maybe years of symptoms. 10 minutes to remember what changed, when it started, how it's affecting your life, what you've tried, what you're worried about, and what you want help with. And if you're already tired, foggy, or feeling dismissed, that's a lot. So today I want to talk about how AI can help. Not how AI can diagnose you, and definitely not how AI can replace your GP, but how you can use it to prepare, organise your thoughts, ask better questions, and most importantly, advocate for yourself more clearly. Because women's symptoms are often minimised, and unfortunately, we often do have to work harder to be taken seriously. And while that should not be on you to fix, there are practical ways to make the appointment work better for you. All of the prompts I share here, I will compile into a document and link it in the description. If you're new, I'm Nina, I'm a GP and former gynecologist, and this channel is all about helping make midlife the best phase yet, without adding to your already overloaded life. So hit subscribe, and now let's talk about using AI to our advantage. And the first thing I would use it for is probably not what you would expect. Because doctors, let's face it, we use a lot of medical jargon and medical terms, and even though we are trained to explain things well, whether someone does or not is very dependent on who is in front of you. And I know that this can make seeking help feel particularly intimidating because the terminology is unfamiliar. You may hear phrases like transdermal estrogen, systemic symptoms, risk factors, and not feel confident to ask exactly what they mean. Maybe you have an idea, but if you're not confident, then that leaves you in a sort of limbo where you're not really sure if you understand. One of the highest leverage ways you can use AI for medical appointments in general is to use it to become medically literate on what you want to discuss. Before your appointment, you can ask AI to explain the common medical terms used when discussing, for example, perimenopause or HRT in plain English. You can ask it for each term to explain why it might matter in a GP consultation and give you a sensible question to ask about it. The aim is not to fill your appointment with medical jargon or to prove that you have done your research. It's to be able to understand and follow the conversation well enough that you can take an active part in it. Because becoming familiar with even just a few terms can help you to ask clearer questions. It can help you to realize when you haven't understood and have a more informed discussion. Of course, you should feel able to say, I didn't understand that, I'm not sure what that means, could you explain it again? That is never a silly question. It's part of shared decision making. But having a basic understanding will help. So now that we have a basic grasp of the terms that might be tossed around in a consultation, it's time to prepare for the consultation. And I would not start with an obvious question such as, do I need HRT? Is this perimenopause? Because AI can often sound very confident and it wants to please you, but at the end of the day, it doesn't know you. It can't examine you. It doesn't know your individual risks properly, and it is not responsible for your care. So don't use AI as a decision maker. Use it as an organizer. Use a more specific prompt, such as, help me prepare for a GP appointment about possible perimenopausal symptoms, ask me questions the doctor might need to know, and then help me summarize clearly. This is much more useful because one of the hardest parts of perimenopause is that the symptoms can often be scattered. You might have irritability, urinary symptoms, fatigue, and because the symptoms are spread across the whole body, often women may present 1 or 2 symptoms at a time. You might have one appointment because you're tired. You might have another one because you have joint pains, another one for recurrent UTIs. And unless someone is thinking about perimenopause or has an awareness of this, they might not connect the dots. If you aren't sure what's going on, AI can help you bring everything together before you go into the appointment. Similarly, if you have a vague sense of, I'm falling apart and I don't really know what to do, you can use AI to help you map what's going on. You might ask it to act as a GP and to ask you symptoms about women's health one at a time. You might tell it that you're a woman in your 40s or 50s and you want to prepare for a GP appointment about possible perimenopause symptoms. And can it ask you about these symptoms one by one? This will help to compile things that you may not have considered yourself. Because you might go in thinking that the problem is memory loss, but when you map it out, you realize your periods have changed, your sleep has deteriorated, your brain fog is worse, you're more irritable, and other things that might be linked to perimenopause. And that would lead to a potentially very different conversation. Not because it proves that it's perimenopause, but it can give your GP a better clinical picture because you're already considering the potential contributors. As a GP, I don't want someone to come in with a perfect medical essay or a list of every symptom under the sun, but having a clear pattern is very useful. You're not trying to convince your doctor of a diagnosis. You're trying to show them the pattern that they need to assess things properly. So that's symptoms. But symptoms alone are not enough. The next bit is the part that I think women often underplay because we're used to coping and getting on with everything, and sometimes we don't want to be a burden. A lot of women in midlife will say, I'm fine, I'm just tired. Other people have it worse. But when you unpack everything, the impact of your symptoms can be very significant, and that is important. One of the things all GPs should take into consideration is the impact of symptoms on a person, because the same symptom can impact different people in vastly different ways. It's not just the symptoms that you have, but it's the cost of those symptoms. To help us look at this, a prompt might look like, help me describe the impacts of these symptoms on my daily life. Organize it into parenting, relationships, sleep, confidence, general functioning. Keep it concise and suitable for a GP appointment. And then it will give you something like, these symptoms are affecting my work because I'm less focused and more forgetful. At home, I feel more irritable. I'm avoiding exercise because I'm exhausted and I don't feel like myself. And that is a very useful and powerful summary that will help to avoid you minimizing the impact of your symptoms. AI can help you name it clearly without feeling like you're being dramatic and ensure that you are taken seriously. So now we're medically literate, we have the symptom map and we have the impact. So now we need to turn it into something concise that you can actually say in a 10-minute appointment. This is probably the most practical tool in the video and the one your GP, I suspect, will probably love. Before the appointment, take all the information that you've gathered and ask AI to turn your notes into a 1-minute summary. And it might give you something like, I want to discuss whether my symptoms could be related to perimenopause. Over the last 6 months, I've been affected with X, Y, Z. This is affecting me because of X, Y, Z. And I would like to discuss potential options or whether I should get anything checked, including whether HRT might be appropriate for me. It's clear. It tells them how it's affecting you. It tells your GP what's affecting you, how it's affecting you, and what you're expecting to get from the appointment. And it also avoids the trap of saying, I don't know, I just feel awful, which is completely understandable. And there is nothing wrong with that. I just want to be clear. Our job as doctors is to ask questions and to get to the bottom of the problem. But when you have such a short amount of time, it's harder to work with, and you won't be able to cover as much ground. A 1-minute summary gives the GP enough information to ask specific questions rather than spending half the appointment exploring everything and trying to pinpoint things. It's more likely then that you're likely to get what you need out of the appointment without having to make continual follow-ups. And we can also use AI to help us prepare any important follow-up questions or phrases that we might want to consider, particularly if the appointment does not go how you hoped, which I think happens more often than we know as doctors. Maybe you feel rushed. Maybe you feel like the GP is focused only on one symptom or is dismissing you and telling you it's just stress and offering you some time off work. Maybe you just freeze and you don't know how to push back or how to advocate for yourself. And look, I'm an actual GP and this still happens to me. I still walk out of GP appointments thinking, I didn't say what I wanted to say, I didn't get what I wanted to get. So if it's happening to me, I bet it's happening to way more of my patients than I realize. So AI can help you prepare phrases that are calm, respectful, but assertive. If you feel like you're being dismissed or not taken seriously, it might give you something like, I understand stress may be part of this, but my symptoms feel different to me and they coincide with changes in my cycle. Could we consider perimenopause as part of the picture? These phrases help keep the conversation constructive, but also allow you to be heard. Advocating for yourself does not mean being difficult. It simply means not leaving without a plan and having your needs and your concerns addressed. So once we've done the appointment and we've seen the GP, AI can also help us after that as well, because we don't want to lose momentum, especially if you're feeling tired or forgetful. After the appointment, it's easy to forget what was agreed or what was said. And I do always suggest taking notes or asking your doctor to write it down if necessary, but AI can also help you to organise your thoughts or your notes. The key is not asking it to reinterpret the medical advice. Ask it to organise only, because AI can hallucinate with surprising frequency. It will lie if it doesn't know the answer, and it wants to please you. You can ask it to turn the notes from your GP appointment into a clear action plan without adding any new medical advice, organising it into tests, lifestyle steps, symptom tracking, follow-up, and when to seek help. And this is especially important for something like HRT because often there's several moving parts. There's what to take, how to take it, side effects, what kind of bleeding patterns might you expect, whether you still need contraception, lots of things that you need to think about. And you can use AI as like a second brain for the admin, but not to overrule your doctor. Before we finish, and having discussed all of this, I want to give you the simplest possible prompt that you can just copy and paste. And it's the all-in-one prompt. So rather than going through step by step, you can give it everything in one. Something like, I'm a woman in my 40s, 50s, whatever, and I'm preparing to discuss perimenopause symptoms, whatever, or HRT with my GP. Please ask me questions one at a time to help me organise my main symptoms, when they started, any changes or other symptoms that might be relevant, medical history, medications, what I'm worried about and the impact on this. Then create a 1-minute GP summary, a bullet point symptom list, questions to ask about perimenopause or HRT, and calm phrases to use if I feel dismissed. Please do not diagnose me or tell me what treatment to take. Help me prepare for a better conversation with my doctor. Something like that. I'll write about one in the description. But it keeps AI in the right role, and not as a doctor or a decision maker or something to diagnose you, but as something to prepare, something to organise your thoughts, to gather the relevant information and to give it in a way that is easily digestible by your doctor. Not to replace them, but to make sure that the appointment reflects what's happening to you and is useful. And I want to be really clear, I know that women should not have to over-prepare in order to be taken seriously. Healthcare should be better at recognising women's symptoms. It should be better at joining the dots. It should be better at listening to women when we say something has changed or I am struggling. But while we are living in this system, we have to use what we can to prepare. AI can help you gather the scattered symptoms. It can help you to see the pattern, explain the impact, and leave with a plan. And most importantly, it can allow you to advocate yourself without feeling like you have to become confrontational. In perimenopause, the problem is often not one dramatic symptom, it is the accumulation, and it deserves a proper conversation. AI will not fix women's healthcare, it might even make it worse, but it can help you walk into your appointment with your story organised, and that makes it much harder to overlook. If you've ever left a GP appointment thinking, I wish that went differently, let me know in the comments, because I think it's way more common than we think, and sharing it can be powerful. If you want more practical videos on perimenopause, midlife health, and navigating this crazy phase of life without adding more overwhelm, hit subscribe and I'll see you next time.